I'm CEO of Profi.me, David Campitulas. We're talking about Jotine Olympic, which is Ability First Medicine rather than Disability First Medicine. This is a ancient medical sect that ties to the ancient Greek tradition that happens to be qualitatively different than the two medical sects that survived through the trauma of the 1910s through World War II. We've shrunk down to two medical sects. You have the opportunity by contract with us to upgrade to Jotine Olympic Ability First Medicine, which allows you legally to specify to patients that you provide Ability First Medicine and list that in your patient contracts. That happens to be incredibly important for having you attract the right patients for your services, and it provides you the right opportunity to practice in a more intimate setting. There's something called the Dunbar number, which is the number of people that you can know well, that you can know personally, and the number is 150. And so physicians that want to practice in a less than 150 employee setting may choose a Jotine Olympic setting and specifying that you practice Ability First Medicine. It's a differentiator. It happens to have the added benefit that your non-surgical effort can be exempt from your obligations as a physician by contract. Because if you're practicing as a team physician, you're doing something qualitatively different than the other setting of care, of which the address for your clinic can't be specified, and anything lower in like a office of professional licensing, such as a trainer, you can specify, as the level of training that you're operating. You don't, you're not necessarily involved with surgical care on the sidelines. And so it's so important for physicians to be offered the opportunity to practice Jotine Olympic, Ability First Medicine, because Ability First Medicine really is medicine, and rather than looking at people as disabilities, but looking at them as abilities. And so there's a stereotype of, say, like there's orthopedic surgeons that want to practice sports medicine, but every medical specialty has physicians that would prefer to practice Ability First Medicine. And because Ability First Medicine is the primary prevention, it is the primary care, and it's the missing part of America's healthcare system. Now, you're able to practice Ability First Medicine with us, where we offer a roster program to help get your roster at your clinic, at your hospital, aligned with you in the Jotine Olympic prioritization of the Hippocratic Oath. Because Ability First has to be specified to all of your employees and all of your patients. It happens to be such an exciting opportunity for you, and so freeing and liberating for you, because you won't have to be everything to everybody anymore. And you can free yourself of all kinds of defensive medicine by specifying, I do Ability First Medicine. I don't, which originates from 103 Good Doctor, Good Shepherd tribes, of which America originates. And, Ability First Medicine existed before 1910 of the Common Era. The coincidence that the religions of medical sects, the third through, 103 other traditions, were winnowed down through regulation doesn't change the fact that there are patients, there are physicians that want Ability First Medicine, that want a relationship that's free of defensive medicine, that's free of, the Trojan horse of defensive medicine, of like suing a physician, under the furtive fallacy, something I elaborate on in my book, Perfecting the Brand of American Medicine. Because the furtive fallacy is that there's bad doctors and somehow suing doctors gets us into a better system. There's no country in the world that litigated itself into having better physicians. Physicians require more training. Physicians are made. There's others that say that physicians are born. That happens to be so important that we offer a third or more option, a third or more medical sect in America for patients and physicians that want Ability First Medicine. And so we ask you to join us where we can help codify that with a SAFEnote. for physicians that are practicing Ability First Medicine, if you have a SAFEnote with us, that helps codify to you and to all of your professional services providers that you practice Ability First, and that you notify all of your patients of that up front. If, and a lot of physicians face lawsuits over their career, if you happen to get sued, your SAFEnote with us is discoverable, and as are the other documents that we help you accumulate to help protect you as a physician under Ability First Medicine. In the Hippocratic Order, that you chose to not be everything to everybody, which isn't realistic. It's why physicians are burning out. It's why there's 300 or 400 physicians that kill themselves every year. And so we're trying to be a part of that solution by offering Ability First Medicine, which you can codify in a SAFEnote with us. You can also codify in a sacrament. So join us at Profi.me, Jotene Olympic, where Jotene is the doctrine of like mitochondria, our last organ. It's a discontinuous organ of mitochondria throughout you. I write about that in my book, Metabolic Topology. And Olympic is the language of the liturgy, where you're able to codify that, your first or even second religion is Jotene Olympic, Ability First Medicine. Again, which increases your defensibility and also increases your authenticity in the kind of medicine that you choose to practice. There were 103 Good Doctor, Good Shepherd tribes. Medical doctor and osteopath were just 2 of them. Those of you that went to medical school, they're medical doctors. You can upgrade your prioritization of the Hippocratic Oath with us and codify that in a way that is more defensible, that helps reduce your malpractice. And we have a track record of helping that happen all over America. Join us at Profi.me.